Welcome back to Health Reimagined, where we break down complex medical topics into simple, eye-opening insights that can help you understand your body better. Today, we're diving into something many people ignore: knee pain. A rheumatology specialist recently shared a powerful idea that knee pain is not always just a knee problem. Sometimes, it can be a window into your entire health. And in this video, you'll learn quick tests you can do at home that may reveal hidden issues with your joints, metabolism, autoimmune system, and even early warning signs of dangerous diseases. Let's start with a simple test you can try right now. First, stand in front of a mirror and lock your knees. Do they seem to bend backward more than they should? This is called hyperextension. Now, try a few more things. Can you bend your little finger backward to a 90-degree angle? How about touching your thumb to your forearm? Check if your elbows also hyperextend. And finally, with your legs straight, can you place your palms flat on the floor? Each one of these flexible joints counts as 1 point. If you score 4 or 5 points, you might have what's called generalized joint hypermobility. For many people, this just means you're naturally flexible, which isn't a problem at all. But for some, it can be a clue pointing towards a connective tissue disorder, like Ehlers-Danlos syndrome. This condition is often associated with other signs, like thin, stretchy skin and bruising very easily. So, if your knees are wobbly and you have these other signs, it might be worth mentioning to your doctor. For our next test, stand with your ankles touching. Now, look at the space between your knees. Is there a gap wide enough to fit more than 3 fingers? If so, this is known as genu varum, or what's commonly called a bow leg deformity. In adults, this is often caused by knee osteoarthritis, where the cartilage inside the joint wears away. As the cartilage thins out, the bones can shift, creating that bowed shape and putting more pressure on the inner part of your knee. But here's the really surprising part. Early osteoarthritis isn't just about aging or wear and tear. It's strongly linked to deeper metabolic problems, including diabetes, high cholesterol, kidney disease, and even heart disease and mental health disorders. This suggests that the inflammation damaging your knee might be part of a bigger, body-wide issue. In some rare cases, bowed legs aren't from cartilage loss at all. They could be a sign of Paget's disease, a condition where your bones remodel abnormally, becoming larger, weaker, and bent over time. Here's a test that surprises most people, because it has nothing to do with your legs. Take a close look at your fingernails. Press the tips of 2 of your fingers together, nail to nail. Do you see a tiny, diamond-shaped window of light between them, right above your cuticles? If that space is completely gone and your nails curve downwards, this is known as finger clubbing. And clubbing can be a major red flag for your health. When knee pain appears alongside clubbed fingers and inflammation along the surface of your bones, a condition called periostitis, it may point to something called hypertrophic osteoarthropathy. This syndrome is often, and most seriously, linked to underlying lung cancer. This is a perfect example of why doctors never just look at the knee in isolation, they look at the whole person to connect the dots. Now let's talk about autoimmune diseases, which often make their first appearance as joint pain. If you're experiencing joint swelling, and your knees feel incredibly stiff for more than 30 minutes after you wake up, it could be an autoimmune issue. Different autoimmune disorders leave different clues. For example, inflammatory bowel disease, like Crohn's or ulcerative colitis, can cause knee pain along with painful red bumps on your shins, mouth ulcers, or eye redness. If you have psoriatic arthritis, you might notice red, scaly patches on your elbows, knees, or scalp. Sometimes these patches hide in your ears or belly button. You might also see tiny pits in your fingernails or notice your nails lifting away from the nail bed. Sausage-like swollen fingers are another classic sign. Rheumatoid arthritis, on the other hand, typically targets the smaller joints first, like the knuckles and wrists, causing symmetric swelling and stiffness on both sides of your body. Other conditions like lupus, Still's disease, and scleroderma can also begin with knee inflammation before any other symptoms show up. It is so important to get an early diagnosis for autoimmune arthritis because timely treatment can prevent lifelong joint damage. If you live in an area with ticks, or you've recently been hiking or spending time outdoors, you need to listen closely. Lyme disease can cause severe, dramatic swelling in just one knee, often appearing months after the initial tick bite. But it doesn't stop there. Lyme can also lead to facial paralysis, meningitis, or even inflammation of the heart, which can be fatal. The good news is that if you find a tick that has been attached for more than 24 hours and remove it, a single dose of antibiotics can often prevent the infection from ever developing. But with Lyme disease, timing is absolutely everything. Next, let's talk about lumps and bumps around the knee. Not all of them are harmless. If you see yellowish, fatty deposits, called xanthomas, their location tells a story. If they're on your knee or on your Achilles tendon, it might indicate a genetic form of high cholesterol. If they appear on your shoulders or buttocks, it could be linked to diabetes or fatty liver disease. Another type of lump, ligoptophis. These are hard, white nodules made of uric acid crystals that can form under the skin. They are a clear signal of high uric acid levels, which can be caused by kidney disease or metabolic syndrome. Untreated gout can completely destroy your joints, but early management and treatment can prevent that permanent damage. Finally, we need to discuss when knee pain is a true emergency. First, there's septic arthritis, which is a bacterial infection inside the joint. The symptoms are sudden and severe: intense pain, significant swelling, redness, and heat around the knee. You might also have a fever or feel generally unwell. This is a medical emergency with a 10% mortality rate, and irreversible joint damage can occur in as little as 8 hours. Another emergency is bleeding inside the joint, called hemarthrosis. If you haven't had an injury, this could be caused by taking too much blood thinner medication, a bleeding disorder like hemophilia, or even a severe vitamin C deficiency known as scurvy. In rare cases, it could be a sign of bone cancer or cancer that has spread to the knee. Any unexplained, swollen joint that might have blood inside requires urgent medical care. So, to be clear, you should go straight to the emergency department if your knee suddenly becomes red, hot, and very swollen. If you have a fever along with the knee pain, if the pain is so bad it wakes you from sleep, or if you suddenly cannot walk or put any weight on your leg, recognizing these signs and acting quickly can save your joint and, in some cases, it can even save your life. Your knee pain might be trying to tell you something much bigger about your health. So pay attention, stay curious, and always listen to what your body is trying to tell you. Thanks for watching Health Reimagined. Stay healthy, and I'll see you in the next video.